Thank you for inviting me. First of all, just give you a little bit of background. I'm a graduate of the West Virginia School of Osteopathic Medicine. I attended family medicine residency through WVU in CMC Charleston. I have been in practice approximately 20 some years. I'm currently with Valley Health, and we have been around serving our community for 40 some years. We've got over 38 locations, including WIC and school-based facilities. And we have specialties from family medicine, internal medicine, pediatrics, OBGYN, ENT, optometry, dental, behavioral health, including psychiatrists and psychologists, and clinical pharmacists, as well as having pharmacies in several of our site locations. We serve over 75,000 underserved, insured and uninsured patients per year. And we have 2 locations where we serve over 400 plus medical assisted treatment MAT patients. And that's what I'm here to talk about is our MAT program. And being in the Huntington, Charleston area in West Virginia, we are leading in numbers with opioid addiction, substance abuse, and our Hep C. And so what I have started, I work with our MAT program in the Huntington location. And I've been working with Matt for 6+ years now. The Hep C, what we try to do is capture the Hep C at the time of a new patient coming in for medical assistant treatment program, the ones that are asking for help. We run our lab work, and then we try to get them situated in the state of West Virginia. One of the biggest barriers is that we currently cannot treat, as a family physician, Hep C without having a collaborative for a GI specialist, gastroenterologist, or infectious disease. So that is one of the biggest barriers to treatment, is because patients, we lose them trying to refer them out. And the overwhelming with the pandemic and the Hep C, trying to get them in to see infectious disease right now in the hospital when COVID is overwhelming is 6 months or more out to get seen. So I have been wanting to take this on because I see the importance of trying to capture the Hep C treatment at the time of visit with us, not only in the primary care setting, but also in my MAT clinic. So Dr. Kara Willenberg, who is infectious disease at Marshall University, has graciously agreed to collaborate with me. So what that entails is the patient sees us in our MAT program. We identify positive Hep C patients, and then I see them in our Hep C ID clinic at that time. And we do the further, in the state of West Virginia, not only do you have to have a collaborative, but you also have to have 2 positive quants 3 months apart. And I think that is also a little barrier to treatment, having those 2 quants 3 months apart. But that's the criteria for West Virginia for Medicaid and Medicare for approval. So we do also have to have the liver ultrasound. We also order FiberSure to check for fibrosis prior to treatment. Most of our patients are more than grateful to be treated within Valley where they feel comfortable. We lose many, many patients when we refer outside. So we've been very successful with our treatment. Typically, we treat with Mavorite, and typically that is an 8-week treatment. And the patients are usually all non-detectable within that 4-week mark. So the treatment options for the Hep C is great success. But like I said, the barriers include some of the West Virginia criteria of family practice not being able to treat without a collaborative on board, and also having that second quant 3 months apart we lose some patients. So that's where we are working with state legislation, trying to get some of the criteria lax a little bit so we can try to get this a little bit more under control. Like I said, the majority of our MAT patients, when they come into our program, are positive Hep C and have not had treatment. Like I said, we provide that care at Valley Health, and we are trying to get more treatment easy accessible. And like I said, also another barrier is the liver ultrasound. We had to refer that out. Whereas if we could just go off the FiberSure to check for fibrosis and liver damage, that would also be easy access for treatment.